Well, thanks for being with us here on Morning Live. Now, as we've been reporting this morning, the World Health Organization has given the assurance that it will continue working with South Africa to prevent and mitigate any resurgence of the coronavirus in the country. Now, the assurance comes as President Cyril Ramaphosa announced an easing of lockdown restrictions with effect from midnight on Sunday as the country continues recording low numbers of new coronavirus infections. And to help us further unpack exactly what the current coronavirus status is in the country, we welcome now the new chairperson of the Presidential Advisory Committee, Professor Barry Schoub. Thanks so much for your time and welcome, Professor.
Thank you very much. Thank you. Thanks for having me.
Let me start by congratulating you on your new appointment, and it's come at a time that has been so difficult, but also at a time when we are starting to move out of the grips that we once were in of this pandemic. So what's your view on where we currently are, Professor?
Yeah, I think it's pretty clear that the epidemic curve is coming down. The rate of new infections is coming down. We need to look at it on a kind of 7 or 14-day average, but even then looking at it, it's still between, or sometimes less than 1,000, or between 1,000 or 2,000 per day. So it's very much less than what it was at the height of the epidemic. There are also a number of other parameters which also seem to indicate that the epidemic is certainly coming down. However, having said that, we need to only look at what's happening with mature epidemics, for example, in Europe and the United States, and in fact most countries around the world which have had mature epidemics. And that is that as the epidemic comes down, of course, restrictions have to be released for economic and human reasons. But then, of course, that does facilitate the transmission of the virus. And then, of course, we are vulnerable to second and subsequent waves. So I think this is the caution which we as professionals need to give to the public, that it's really not a time for complacency. It's great news, it's good news that the epidemic is coming down. It's good news that we can open up the country, but we still need to be wary of the fact that there is still a threat. The virus is out there, and also the majority of population are still susceptible to the virus. The great majority have not seen the virus and therefore don't have any immunity. So the virus is there, it hasn't gone away, and it's only waiting to kind of have a build-up of susceptibles to then cause another wave. So we need to be pretty careful and keep up with all those precautions, preventive measures that we had during the lockdown, during the height of the epidemic.
So looking at current projections and also going on what has happened in other countries, Professor Schoub, what is the likelihood that South Africa would experience a second wave if indeed we continue on the same trajectory that we are currently on?
I think there's a great likelihood that there will be a second wave. What we can't predict is when and also how severe it will be. Hopefully it won't be as severe as our first wave, but many of the countries which did have second waves, in fact, it was more severe than the first wave. Hopefully we won't have that. We do have a lot of knowledge now. We are more prepared now. But there will be a second wave. I think that's almost inevitable. Only question is when and how much.
So with that in mind, what is it that we can do right now as a country to better prepare ourselves so that, it doesn't hit us as hard as we've seen in countries such as India, for example, and the United States?
Yeah, I think we need to maintain our awareness of the need for prevention. We can't, unfortunately, relax those preventive, the wearing of masks, for example, physical distancing, avoiding social gatherings and congregate settings for a prolonged period of time, keeping our guard up. I think we have to maintain that because that is the only way that we have of preventing virus transmission. We don't have a vaccine as yet. And we're really left with only these, what we call the non-pharmaceutical interventions.
So talking of vaccines at the moment, what do you believe is the most promising right now from what is being done across the world, Professor Schoub?
Well, let me take a step back. There are actually now 240 vaccine candidates, believe it or not. And of them, about 40 are undergoing clinical trials. 8 of them are the more advanced clinical trials, what you call the phase 3 trials. And so far, of those 8, the data have been very promising, which has been published. But of course, I must emphasize this preliminary data from the trials. It does show that the vaccine is effective in terms of producing what we call neutralizing antibodies, and also it seems to be very safe. But these, of course, are only preliminary data. Still has to go quite an extensive amount of evaluation, and then, of course, before it is licensed. So that is going to take a bit of time. But of those 8, it is so far good news.
And how long do you think we still have to wait?
Well, I think we're probably going to get some batches of vaccines sometime during next year. I think this is what we're anticipating. Exactly when is difficult to say, because I say it's a long process which still has to go in terms of evaluation, because we do need to make sure that the vaccine is safe as well as being effective. So it has to go quite rigorous oversight before being licensed. And that's probably going to take us well into next year.
And in the meantime, Professor Schoub, what's the best preventative methods that we can ascribe to? And also, just in terms of treatment right now, which are the most effective treatments against COVID-19 at the moment?
Well, in terms of prevention, as I said, we need to kind of keep up our vigilance with those preventive measures, which we were exercising during the height of the epidemic. Wearing a mask, avoiding the physical distancing, avoiding social gatherings, avoiding those parties and so on, and also washing one's hands, keeping one's hands clean, sanitizer, and washing with soap and water. Now, these are all the hygiene preventive measures which are very effective, provided, of course, that we all keep them quite rigorously. In terms of treatment, of course, we have learned quite a lot. Certainly, high-flow oxygen therapy is a mainstay in the early stages of treatment. And then various drug treatments have advanced. Steroids such as dexamethasone have proved to be quite effective in the latter stages of the disease. So all our management parameters have improved. And obviously, that's good news. We have learned quite a lot. And we all keep learning how to manage this disease.
So with the easing of lockdown regulations, the restrictions are being eased. One of the things that we will now be allowed to do under lockdown level 1 is, for instance, travel, Professor Schoub. But which would you say is the safest way to travel?
Well, the safest way to travel, of course, is your own car. Because public transport, of course, does pose a danger. One is in close contact; it's difficult to keep that physical distance. Obviously, public transport does ensure or does demand that people do wear masks, but you are in a closed environment, whether it's in a taxi, whether it's in a train, whether it's in an aeroplane. So those all do pose a certain degree of risk. So obviously, the most safe would be in your own car. Obviously, in many situations, not feasible.
So if it were entirely up to you from a scientific perspective, would you say it is actually safe to travel right now, given that we are expecting a second wave?
Well, I think that the epidemic has come down. I think provided those measures which are put in place, wearing of masks and so on, one does limit the risks. Of course, nothing is risk-free. But one has to weigh up all the other considerations, economic considerations, human considerations, and so on. So I think now we're in a better position than we were, obviously, a month ago. So it is obviously safer now than it was a month ago. But I think what's very important that we still do need to keep, as far as possible, those precautions, those hygienic infection prevention precautions.
And then, of course, we are moving around quite a lot more. We are, as you're saying, trying to maintain those precautions that we had at the height of pandemic, social distancing and so on. But there was, of course, talk at some point as we continue to learn about this virus, Professor Schoub, about herd immunity. And just looking at what's happening in South Africa right now, do you think that we have achieved some level of herd immunity? And maybe going back before we answer that, what does that mean first and foremost?
Okay, what it means is it's a synonym really for population immunity. In other words, there's a level or a threshold where the immunity in the population will impede the spread of the virus, will stop the virus from spreading. That we refer scientifically as herd immunity. Now, it is a dynamic threshold. It moves, and it moves depending on how rigorous we are in our measures to stop the virus being transmitted. The obvious way is, of course, vaccine, because the vaccine imparts a artificial immunity in the population and thereby stops the virus from spreading. But also there's natural immunity. Once one has had the infection, one is immune as well. So after a certain number of people have had the infection, plus our measures, our preventive measures to stop the virus being transmitted, the masking, the distancing, the social gathering, etc., we can then bring down what we call the reproductive number. Reproductive number is the number of people that are infected from an infectious person. We can bring that down by our hygiene preventive measures. And then we can lower that threshold. So that threshold is a moving threshold. If we do nothing at all, then the threshold for coronavirus is a figure of 2.5. But as we progressively have more people that are infectious and are infected and are immune, and as we also do our preventive measures, we can lower that R number. If we lower it to below 1, for example, then the epidemic will gradually decrease and could then kind of stop, in fact.
And of course, there's the issue of people who are asymptomatic. Now, are those who are asymptomatic more contagious?
No, they're not more contagious. In fact, there is some literature that they might be slightly less contagious. But we do take it that asymptomatically infected people are, in fact, a potential risk of transmitting the virus. There's no evidence that they're more contagious, but the problem, of course, that you can't recognize them as being a source of infection. And that's where the danger is.
And as we've seen the numbers decreasing, and we recorded this morning again another decline, weekly decline. And if we look at those numbers, Professor Schoub, and listening to what is being said, there was a report from our reporter in Kenya, Sarah Kimani, talking about how Africa as a continent needs to test at the level of around 30 million. Should we be doing more testing at this point as South Africa?
Well, we are doing a lot of testing. Of course, many millions of tests are being carried out. But obviously, the more tests that one does, the better one has a handle on the extent of the infection. And therefore, one can also pick up hotspots of infection and do contact tracing and thereby try and limit transmission of the virus. So the more one tests, the better it is. We are doing quite extensive testing, probably more than anywhere else on the continent. And that's good. But clearly, there's also room for more testing.
One of the other issues that have been a concern is, of course, the fatality rate, just in terms of the numbers and how they are being recorded. What's the latest as per your discussions in your council with regard to this, Professor Schoub? Because there was a concern at some point that perhaps these numbers are not being recorded accurately because there would be people who are not getting tested, who are perhaps just dying at home and therefore are not recorded.
Well, that's always a question mark, how many people are not being recorded who die. I don't think that there's a significant number who will be dying at home and aren't being picked up. Is the reporting of mortality accurate or not? Of course, that's always a question mark. It would be better in the private sector than the public sector for obvious reasons. But it's always a guess. We don't really have any scientific way of knowing how much there is underreporting. Our mortality rate is low. Of those that are infected, it's about 2%, just over 2%, which is certainly lower than what was experienced in Europe, for example. Now, that may be a factor, maybe one of the factors, as we discussed earlier, that the extent of severe infection is less in South Africa or in Africa as it is in Europe. Or it may also be contributed to by the fact that the reporting of mortality is lower. At this stage, we can't quantify that amount.
So just a final question, Professor Schoub, as we move to level 1 on Monday, what is the one key thing that you would want South Africans to take cognizance of?
I think the key thing is that we still need to be vigilant. We still can't be complacent. The epidemic might be coming down, but it's not over. The virus is still in the population quite extensively. There's still quite a massive virus in the population, and the majority of the patients still remain susceptible. So as much as people will carry out those hygiene preventive measures that we all kind of publicize, so we'll stop, hopefully, a second wave, or if we do have a second wave, we'll make it very much less than what we experienced up to now. So vigilant is certainly the key word.
Professor Schoub, we wish you well in your new position, and thank you so much for speaking to us here on Morning Live.
Thank you very much for having me. Thank you.
And that, of course, was the new chairperson of the Presidential Advisory Committee, Professor Barry Schoub, who has taken over from Professor Abdul Karim for talking to us about the latest information they have on the coronavirus. So this is where we say goodbye to our SABC